Hiya, this is me, and this is all part of this. So, do you know what I do? And I put this up on Facebook, this question. People didn't answer, so I assumed therefore that then people didn't know what I do. And what I thought I'd do is begin to introduce from my qualifications through to some of the medical problems that people have that they come along with. And then I thought I'd sort of talk about the problems that people report, because there's a really big difference between a medical diagnosis. So if somebody is diagnosed, say, with Parkinson's, let's say, let's just randomly choose something out of the hat. If somebody's diagnosed with something such as Parkinson's, the actual presenting signs and symptoms, problems, issues that that person can have in their life can be very different. Everybody's slightly different. What can impact and affect one person hugely, it doesn't affect somebody else. The progression of a disease, disorder, whatever you want to call it, it varies so much from person to person. So it might be that they bring these medical labels, but what actually happens is that what I'm interested in is what that person says to me that they have that is the problem. And because it may be that something that for one person with a medical condition is a problem. So it might be that, say, somebody with diabetes, one person might find it's a real problem to them to remember to eat the right foods and look after themselves that way. And for somebody else, it might not be a problem, that they can just manage to do that. And that might be because they've got sufficient money to go out and buy the food, sufficient time to organise things, supportive environment around them, the work, you know, you can imagine all of the different things that can fit together. So a lot of times what actually happens is that people come in and they have this diagnosis, but that actually what I'm really interested in is, well, you know, what are the problems? What are the problems that you would like to address? So if I just run through some of the problems that people report, and the biggest one in terms of physical is pain. That's the big one. Acute pain, new pain, short pain, that's what we mean by acute pain. Acute pain is short duration pain. It's a brand new pain, but we'll talk about this another time, perhaps in a Facebook Live or something similar. But pain, big pain, little pain, whatever you want to call it. Persisting pain, pain that doesn't seem to go away, that you manage in the same way that you normally do, but it just doesn't go. Chronic pain, which means it's been there for a long time. You know, you've had back pain, the pain's been there for months and months and months and months and months, just doesn't seem to be going. Maybe even after surgery, the pain's still there. And recurrent pain, so it goes away, but then it comes back again. And it goes away, and then it comes back again. You don't know why it keeps doing this. Pain not resolving and interfering with life. I've got a list here because I thought it would be easier to read off the list. Pain that's not resolving and it's interfering with your life. Because that's the pit. If you've got something that's going on and it just keeps interfering with what it is that you want to do. So, and it might be anything. It might be work, it might be hobbies, it might be going to the theatre and sitting in the audience, it might be driving long distances, it might be looking after the grandchildren, it might be during pregnancy. It could be anything that's just really interfering with your life, all right? And pain is a big one. Physical pain is a big one, because people get very scared, and you know, I'm the same. I get pain on occasions. I hurt myself, like all of us do. What else? Well, poor balance, physical things like poor balance and low mobility. That's a sort of something that goes on. It starts to happen quite young, actually. People who spend a lot of time sitting at the desk, who don't do much physical activity, who don't have hobbies, where they move around a great deal. They begin to start to lose their capability to balance and do sort of fine controlled movements, sort of stepping across, balancing on one leg, hopping, skipping, jumping, running, things like that. And then of course it can start to progress into quite low levels of mobility, and sometimes when I'm sitting in the supermarket having a cup of coffee in a certain chain store, I'll look around at some of the people walking and thinking to myself, oh, I just wish you'd all do more so that you actually look after your mobility as you get older. Fear of moving. Fear of moving can be big, because sometimes for some people they can actually get to the point where they're so scared of falling down that they fear moving, that they actually don't get out of bed. And I actually did a house call on somebody who was just the same as that. She'd had a fall, been in hospital for ages, come out of hospital, she was being hoisted from bed to chair to commode and this, that and the other. Could move around brilliantly in bed, but she was so scared of trying to get out of the bed and walk with her walker because she was so scared of falling over again. And fear of moving is also there, because people can have issues with controlling the way that their body moves through space. If you've got one of these neurological problems, you can have a tremor, a shake, and you go to pick a coffee cup up and you can knock it over, or you can spill it on yourself. Inabilities to distance walk and climb stairs. Those are other things that I see, and again, those can be things that people start to notice either because they've got pain, or just because they begin to start to notice they can't do what they did before. They want to go out for a long walk and they find that something gets in the way and they can't do it. They want to go up and down stairs. They want to be able to do what they did when they were 10, 15, 20 years younger. They can't. Inability, as I said, to run, to hop, to jump, to leap, to bound, to climb, to perform. Actors, musicians, people who are using their body the whole time in their physical sense, when they're actually moving, they want to improve their ability to use their body. They want to improve their ability to perform. They want to improve their ability to, say, produce a voice, to have more control over their breath, to dance, to drive. People have breathing troubles, who get short of breath, who find that they overbreathe, they hyperventilate, and they get very tense. Voice control. So sometimes people come in. I had a gentleman recently who got and when I went in to see him, I said a few things to him, and we did a little bit of work around the mouth and the voice and the throat, and he has begun to talk normally again. There wasn't a stroke, he hadn't had a stroke, but again, that can happen with strokes, neurological problems, just aging. And his granddaughter said it's the best thing he's done, because she can hear him. She said, I can hear you now, Grandad. This is brilliant. It's the best thing you've done. Old or new trauma. So old or new trauma, so it can be that working with somebody, there's some sort of brain and nervous system, a memory that's there, that the person doesn't even recognise that they've got, and for some reason they're presenting the signs and symptoms. They perhaps don't even know why. But trauma can be, and it's trauma to the person, so it's not a question of how big the actual event is, it can be how the person responds, or what's gone on in their past, what's tucked away inside their memory. Poor confidence and anxiety. Underachievement. People are just not achieving, they're just not performing as well as they want to in sport. They always seem to be coming second, or they're not getting the hole in one. And they want to have a different way of approaching the game mentally, and a different way of moving physically. They've got really strong habits and patterns, and they just want to learn how that they're going to do what it is in a different way. Trips and falls, I said about balance. Incapacity after surgery. Sometimes people go into surgery, I'd like to see them more beforehand, but sometimes people go into surgery and then afterwards they're just not making the progress they wanted to, or they thought they were going to do. And oftentimes, I'm afraid that unfortunately our National Health Service system, and also sometimes even our health insurance system, doesn't give the sufficient support for people, and there are lots of things that people can do in order to get really back as good as before and better than that. So all sorts of surgery. Incapacity after illness or cancer care, that's another one where people are really pulled down by an illness, and they want to just begin to build themselves up. They want to begin to start to move. They want some advice on how to start to engage their body. They've lost faith in their body. Ongoing fatigue, people who get very tired. I've said about poor performance in sport or business, because it can be either. Recurring injuries, so again, people who keep finding that they are hurting themselves. Relationship issues, people who don't know how to communicate with themselves inside their head or with other people. And what they're finding is that those kind of relationship issues to do with communication, etc., are causing them problems. They're finding that they are getting the same responses the whole time, and maybe what they need to do is review and reflect on the way that they're using their language, the way that they're creating habits and patterns. So that's some of the things that people report when they come to see me. And I guess that, I don't know if that helps, but it's quite a broad spectrum. And this is also what I said earlier. This is also about the fact that I work with individuals. And if I work with an individual over time, through their lifespan, firstly, they're going through different phases. So if I really get on with somebody, and as I say, I'm quite a strong personality and I know my stuff, but it doesn't mean that everybody gets on with me. There are going to be some people who just don't want to work with me at all. And so if somebody gets on with me and I get on with them, and you get a good rapport relationship going, invariably what happens is that they will phone me up to say, is this something that you deal with? Do you work with this kind of thing, Jill? Can you help me with this? And so I will then work with them as they go through their various phases. They may come to me when they're pregnant, and it might be that when they're coming to me, it turns out that they've got various other problems. It might be that they then, a year down the line, it turns out that they've had some surgery for something and they give me a call. It might be that a few more years down the line, they fall over skiing or something and break their leg. I mean, this poor person is not having a happy life. But what I'm trying to illustrate is that because I work with the person, it's that personal relationship which is more important than anything else, because I'm perfectly willing to go off and research and find out if there's any other way that I can work with somebody to help them. So I've got so many tools in my Mary Poppins bag of tools anyway, but I'm research and science based. So I will go off and try to find out if there's some way that I can work with somebody that can actually enable them to get that quality of life. And that's what I do. I work with individuals. Everything's confidential. So when somebody comes to see me, I'm not going to discuss that with somebody else. I never disclose who it is that I work with. I think the only time I ever mention people I've worked with is maybe 20 years later, when it's all so far in the past, and then I don't go into content anyway about what it was that they came to me for. But yeah, that's what I do, and it would be lovely to meet you sometime. If you want to know more, you can always phone me, and it's quite easy to get hold of me and ask, because if it's not something that I think that I can work with, I can usually put you in touch with somebody different. If it's just obvious that we aren't going to get on, I can always suggest somebody else as well. But yeah, that's the sort of things people bring, and there'll probably be more things that I think of. Take care.